Congratulations, whether you're expecting or you've just welcomed your little miracle into the world. The first 3 months are honestly a magical and sometimes overwhelming journey. In today's video, we'll walk you through exactly what parents should expect from the newborn baby, both boys and girls, from day 1 to month 3. We'll cover what's normal, what to do, what not to do, and how to make this stage more rewarding and, a bit less stressful. Stay tuned because every tip could make your parenting journey smoother. Here's a quick spoiler. Your newborn is not just eating and sleeping. Every cry, every tiny movement, every growth spurt is shaping their future and your bond with them. And there are also a few mistakes parents make without realizing that can affect both the baby and themselves. Let's dive in. Day 1 begins the moment your baby takes their first breath. What should you expect? Let's break it down. Physical appearance. Boys and girls may both look wrinkled, red, or even bluish at first. Don't panic, it's normal. Heads may appear cone-shaped due to delivery. Some babies have swollen genitals from birth hormones. This is temporary. Reflexes. Rooting reflex. They turn toward touch on the cheek. Grasp reflex, tiny hands clench your finger. Startle reflex, sudden flailing when startled. Feeding. Expect to feed every 2 to 3 hours, breast or bottle. Newborn stomachs are only the size of a marble on day 1, then a walnut by day 3. What parents should do? Skin to skin contact regulates baby's breathing and temperature. Track wet and dirty diapers. A key sign of hydration. Learn to swaddle safely. What not to do? Don't panic if your baby loses some weight in the first week. Up to 10% is normal. Don't give water or other fluids, only breast milk or formula. Parents, drop a comment below. Did your baby surprise you with their first cry or first grasp? We'd love to hear your story. By the end of the first month, you'll start to notice patterns. Sleep patterns, 14 to 17 hours a day, but in short bursts. No circadian rhythm yet, so nights may feel endless. Crying. Expect 2 to 3 hours of crying a day. It's their only way to communicate. Boys and girls cry equally. It's not gender-based. Early milestones starts focusing on faces about 8 to 12 inches away. Can briefly lift their head during tummy time. May start cooing sounds. What parents should do? Respond to cries, 9. You cannot spoil a newborn. Begin gentle tummy time, just a few minutes a day. Talk and sing to your baby. Language skills start here. What not to do? Don't put baby to sleep on their stomach. Always back to sleep to prevent sides. Don't compare your baby's growth with others. Each baby is unique. So, month 2 is where the magic really begins. Your baby starts showing you their first real social signs. This is the time for those first true smiles. And nope, it's not just gas. You might notice your little one following objects with their eyes and showing improved head control. When it comes to feeding, growth spurts can lead to cluster feeding, and you can expect about 5 to 6 wet diapers per day, which is a healthy sign. Sleep-wise, babies are still waking up pretty often, but some might start stretching nighttime sleep to 4 to 6 hours. Emotionally, your baby is recognizing your voice and scent, and both boys and girls benefit equally from active bonding. So what should parents do now? Smile and interact. It really boosts your baby's emotional development. try introducing simple high contrast toys and begin gentle routines like bedtime songs and dimming the lights. But hey, don't overstimulate. Too many toys, lights, or sounds can overwhelm your little one. And don't ignore postpartum emotions. If you're feeling persistently sad, anxious, or detached, please seek support. Parents, tell us in the comments, when did your baby first smile at you? That's a milestone worth celebrating. By 3 months, your newborn is becoming so much more alert, interactive, and social. Some milestones you might see include laughing and cooing more, recognizing your face from across the room, lifting their head and chest during tummy time, and those little hands finding their way to the mouth. Sleep usually totals 12 to 16 hours, and some babies may sleep longer stretches at night. Physically, your baby is gaining steady weight and length, and their head shape might round out a bit more. What can you do to help? Encourage movement with safe play mats and tummy time. Read books aloud because language exposure is super important. And encourage social interaction with smiles and eye contact. On the flip side, don't use walkers or unsupported sitting devices just yet. And try not to compare girls and boys in terms of strength or talkativeness. Differences at this age are really minimal. Let's talk about some common challenges because honestly, every parent faces them. Colic can show up as excessive crying, often in the evenings. If that happens, try soothing motions, white noise, or gentle tummy massages. Spit up or reflux is also very normal, as long as your baby is gaining weight and not in pain. Just keep your baby upright after feeding. And let's not forget parental exhaustion. It's real. Sleep when the baby sleeps, accept help when it's offered, and remember, mental health check-ins are absolutely vital. The first 3 months are honestly a roller coaster, but remember this, you're not alone. Every newborn is unique, but the love and bond you're building will last a lifetime. Be patient, stay flexible, and don't forget to take care of yourself too. If you found this video helpful, hit the like button, subscribe for weekly parenting insights, and share this with a new parent who needs encouragement. And tell us in the comments, what's been your most surprising moment with your newborn so far? Your story might inspire someone else. Thank you so much for watching.